I think I would sum it up with and echo what Renee just said, that surgical capacity is very difficult to build, but I will focus on not only surgical capacity in hospitals in the Middle East, but specifically in the private sector, because unlike the West or the US and Europe, we have unique challenges where private sector versus the public sector in the Middle East has different struggles. We all share the same struggles with turnaround time, with the turnover of nurses, with how can we make sure we retain nurses and all of that. And that is specifically true post the pandemic. So we've seen a large exit of nurses out of the profession as a whole, and specifically out of the OR. I'll speak of my areas. The hardest places to recruit for have been the OR. And you would think that's not the case, because the OR has sort of during the pandemic had been put on hold, but those OR nurses sacrificed a lot of time and energy to start rebuilding their skills and all of that. And the retention was not there for 2 years. So we're sort of post-pandemic have increased the resignation. But even before the pandemic, the OR has always been a place where it's very difficult to recruit. Graduates, all new grads, do not get enough exposure to the OR. So the education and the service sector don't link up on the OR. So the natural answer would be, let's create a certification program, a residency program, wherever you are in the world. That's called different things, but there has to be something that bridges that gap from graduation to a practicing OR nurse. It is the one place that is very high stress, very difficult. It's one-on-one nursing. And if you don't know the OR, you can't function. You either know it or you don't. And to be able to know it, you don't graduate knowing it. So there's got to be programs in place, such as the one that just described, and partnership in place across all hospitals, and OR consortiums or anything like that, that can prepare nurses that are new grads that want to start a career in the OR, or returning nurses, an ICU nurse that decides to say, okay, I'm going to give the OR a try. How do you build those skills? Because if you don't know the OR, it's a very scary place. Nobody graduates and says, oh yeah, I want to be an OR nurse. You don't get enough exposure to know it. So there's really a lot of training that has to be done, whether it's new grads or seasoned nurses, to be able to get them comfortable with the concept of an OR. And then the possibility of retaining them after that is higher. The other things we face that are unique to us is our dependency on foreign nurses, right? And nurses that use the Middle East or use the UAE specifically as a stepping stone. We spend a few years and then move out to the US, the UK. So really there needs to be a concerted effort to focus on local nurses, focus on local programs that can actually entice people to stay not only in OR nursing, but also within the country, and give back expertise, give back clinical skills, and stop the constant bleed out, and sort of, replenish nurses with a constant pipeline. And the things to do that with are partnering with universities and partnering with companies such as ARN, North Campus, to be able to create residency programs that are at the hospital level. We partner as a hospital, a group of hospitals, if it's not every single hospital, with someone that can teach nurses, can show them, mentor them, increase their critical thinking skills, and increase their comfort level with surgical nursing, with OR nursing. Perioperative nurses are not made, they're made, they're not born. You're not something that is easy to come by. And then you've created a retention program that keeps that pipeline feeding. Give them opportunities, have succession plans, have an opportunity to do. OR nursing is very diverse if you really look into it. They don't have to be stuck in one. There's different services they can cater to. There's inpatient, outpatient. There's a lot of opportunities in the OR once you get to know it. But the only way to do that is through residency programs or through certifications, through postgraduate programs that focus on perioperative nursing and nothing else. And that would teach them team building. That would teach them the critical thinking that they need, and would result from the hospital side, for selfish reasons, it would help me retain those nurses. It would help us compete with the public sector compete with everybody else that wants to sort of recruit all the high quality nurses. There's got to be programs in place that retain them and keep them. And the only way to do that is through education, is through opportunities that they see as fit for them and all others. So I definitely echo what everybody said, and I look forward to other experiences. Our experience in the private sector has been difficult. It's not easy. It has been very difficult to attract qualified OR nurses, to retain them, to keep them. It has been very, very difficult. So I look forward to hearing from others. And maybe we can work together on creating a residency program throughout the UAE, creating a residency program throughout the private sector or throughout the public sector. So nurses have a choice when they graduate and have something to fall back on.